It may seem overwhelming and confusing when you first start to learn about how blood flows through the heart and how everything works. But once you review it and practice it and get yourself a diagram, and label the flow of blood through the heart, I promise it will become more simple as you get a little more practice with it. Something you guys want to keep in mind. So we actually have 3 circulation systems of the body. Okay, now that might sound confusing because yes, of course they're all connected, they all work together, but we break it down into 3 separate circulation systems, and that's the coronary system, so our heart's own flow of blood, the pulmonary circulation system, so our lungs, and then our systemic, so the rest of the body. So just make sure that you know that it's kind of broken. Our circulatory system, our cardiovascular system is broken down into those 3 separate systems that all work together. Let me also pull up another image as we're going to talk here. Let's see, and this will help give a visual as we're talking about this. Okay, here we go. Okay, here we go. Here it comes. Must not have the fastest internet connection here. Okay, there we go. So you guys know now, right? The heart is the pump. It's the center of our cardiovascular system. It's roughly the size of your fist, and it sits in the center of our chest, vertically between the 2nd and 6th ribs, with a little bit more of the heart just to the left of our sternum. Okay, so the pericardium, and you can see that in the bottom right corner of our picture here. The pericardium surrounds the heart and is attached to blood vessels. The wall or body of our heart has 3 layers, and you need to know these different layers. This is the epicardium, the myocardium, and the endocardium. So make sure you review those, all right? Those aren't specifically shown in this image, but you can read about those in your textbook. Now, I mentioned that the bottom right is where the pericardium is labeled, but make sure when you're talking to a patient and talking about a patient's body and its structures, that you're referring to it in the anatomical position, okay? Now, there are 4 chambers inside. We have the left and right atria, as you can see at the top there, and we have the left and right ventricles. There's also 4 valves that keep our blood flowing in the correct direction. We have the tricuspid valve, as you can see labeled here. This is between the right atrium and the right ventricle. We have the bicuspid valve, which is also called the mitral valve, and you can see that labeled here between the left atrium and the left ventricle. We have the pulmonary and aortic semilunar valves, which you can see labeled there. Let's see, I think they're labeled as just pulmonary and aortic. They're called semilunar valves because you can see the shape of those little leaves that open and close. Those are the valves themselves. The pulmonary semilunar valve is between the right ventricle and the pulmonary artery, and the aortic semilunar valve is between the left ventricle and the aorta. So 1 beat of our heart is a complete cardiac cycle. This is going to include the atria contraction, the ventricle contraction, and recovery. So our heart recovering, relaxing, and refilling. The average adult heart beats between 60 and 100 beats per minute. Both of our atria for the 1 cardiac cycle begin in a state of relaxation, where blood flows into the right atrium from the superior and inferior vena cava. Once the blood has come in from the vena cava into the right atrium, it's going to flow into the left atrium. The right atrium is going to contract. The tricuspid valve is going to open, and blood is going to also flow into the right ventricle. Atrial contraction occurs simultaneously, forcing blood into both of the ventricles. So this is all happening all at the same time. As the atria are relaxing again, the ventricles are contracting. So top and the bottom go on opposite of each other, right? When the ventricles contract, it forces blood out of the heart. And because those ventricles are pushing blood into different parts, let's talk about that. When the ventricles contract, the right ventricle is pushing deoxygenated blood, so blood that has carbon dioxide and waste products, into the lungs. So again, when that right ventricle pushes our blood into the lungs, it's going there so that it can get nutrients and fresh oxygen, okay? The left ventricle, when it contracts, pushes our blood that has fresh oxygen from the lungs into the body, okay? Because our body needs that fresh blood full of oxygen. So, with one exception, and I'll tell you the exception in a minute, our arteries carry oxygenated blood away from the heart and to the rest of the body, versus our veins, which carry the deoxygenated blood from all the cells of our body back up to the heart to go into the lungs and pick up fresh oxygen, okay? Now, there is one exception to this rule. So arteries carry oxygenated blood, veins carry deoxygenated blood. The exception are the pulmonary arteries and veins. You need to remember this. The pulmonary arteries carry deoxygenated blood, and the pulmonary veins carry that fresh oxygenated blood from the lungs back to the body. The reason they it's different. So why didn't they just call them, a vein or artery, switch them? Because based on their structure and function, they are still arteries and veins. Again, this is just the one exception to the rule of them carrying oxygenated versus deoxygenated blood. So again, I suggest you get an image like this that's blank and practice labeling the parts of the heart and the flow of the blood. Now we're going to talk about the electrical system of the heart. And this image is pulling up, and I'll share it in one moment. So this is something I'm going to point out to you now that is specific to some NHA review material that I want to provide for you that is not focused on as much in the text, but you do need to know it. So our heart is an electrical system. That's how it works. Our heart, let's see. Oh, yeah. So when we're talking about our heart, we have to talk about this electrical system because, again, that's how it works. We're going to talk about the SA node, as you can see in the top of that image, the AV node, the bundle of His, which is not, let me see, not specifically labeled in here, but that's okay. I'm going to tell you where it is. The Purkinje fibers, which you see at the bottom. And we're going to talk about how this electrical flow works. So backing up just a tiny bit for a second, the medulla is a part of our brain. But the reason we're pointing this out now is because the medulla is the command center of our cardiovascular system. The medulla is what sends messages to our heart to tell it to pump. And the medulla sends that message directly to the SA node. The SA node is considered the electrical pacemaker of the heart. Make sure you remember that. The SA node, the electrical pacemaker of the heart, that is where the message from our brain to pump is initially sent. The conduction system of our heart consists of two nodes, the SA node and the AV node. Like I said, the SA node is the heart's pacemaker. It triggers impulses, our heartbeat, at a rate of about 60 to 100 beats per minute. The impulse from that SA node, as you can see in this image, originates in the back wall of the right atrium. It then goes, that electrical signal goes through both atria and then to the AV node. The AV node is important because it causes that electrical impulse to pause or slow down. And it does this because it needs to tell that electrical impulse, like, hey, slow down. We need time to make sure that the blood in our atria like gets all the way out and into the ventricles. Because if it went too fast, if it didn't slow it down, the atria wouldn't be able to empty fully. After that electrical impulse goes to the AV node, it then goes to the bundle of His, which I can't use my arrow on here. You won't be able to see it, but it's basically before the bundle, excuse me, before the left and right bundle branches separate, as you can see in this image, that's the bundle of His is just above that, okay? The bundle of His has those two branches, the left and right bundle branches. After the electrical impulse has gone from to the bundle of His, it then goes through both bundle branches to the Purkinje fibers. As you can see, the Purkinje fibers are all spread out like little fingers in the ventricle walls. That's the muscular wall of the ventricles. So when that electrical impulse gets to those little fingers of the Purkinje fibers, that's what causes the contraction of the ventricles, therefore pumping our blood into our body and our lungs. So as a recap, the electrical impulse hits the SA node, then the AV node, then the bundle of His, then the right and left bundle branches, and then the Purkinje fibers. So real quick, the valves, what's their purpose? We have those 4 different valves in our heart. They keep blood flowing in the right direction. They prevent backflow because we don't want the blood to backflow into the different, the atria and the ventricles. So that's what the importance of the valves is. All right, so now let's talk. I'm going to stop sharing that. And we're going to talk now about our vascular anatomy. All right, let's see. So our vascular anatomy is, when we say that, we're talking about our arteries, our veins, and our capillaries. Phlebotomists, we collect blood specimens from veins, but there are some instances when blood is collected from arteries and capillaries. Capillaries, as a recap, are basically where arteries and veins meet up. And I do this because it's kind of like a spider web. So our arteries and veins meet up like this, and that's where they do gas exchange, okay? So capillaries, at the capillary beds, okay, it's called the capillary bed, that's where oxygen and nutrients move from the arteries, into the cells, and where the waste products and carbon dioxide move out of the cells and into the veins to go back up to our heart to get those fresh nutrients and oxygen, okay? Let me see if I want to say it. Oh, and this all happens, the capillary beds, how that all works is through the different processes called osmosis, diffusion, and filtration. So you want to be familiar with those words. Osmosis, is the diffusion of water through a semi-permeable membrane. Diffusion is the movement of a substance from a area of high concentration to an area of low concentration. And filtration is the process that separates substances by forcing them through a membrane. You don't have to fully understand yet how all that works, be familiar with it, and that's the processes that happen in the capillary beds. If you choose to go on and further your healthcare career, say nursing or doctor or whatever it might be, you're going to have more in-depth knowledge of all of these processes. So most often as phlebotomists, we are collecting blood from the veins. Arteries are carrying blood away from the heart, as we said, but there's something that arteries have that veins don't, that make those less desirable for venipuncture. And what that is pressure, more pressure. So if you think about those ventricles, those big, they're bigger than the atria, right? The big ventricles, they have those thick muscular walls. We just saw that in the image. When they contract, there's a lot of force behind that, because when those ventricles contract, they've got to get the blood to go to our tippy toes, right? So there's got to be pressure there. So puncture an artery, that's when you see in dramas, like the artery's been punctured and there's blood spewing out. There's a lot of pressure there. So that's why we avoid those for venipuncture, for just routine venipuncture. We do, like I said, draw sometimes from the capillary. That's what we call a dermal puncture. That's like the So you're going to want to review in your text the difference in composition between specimens when they're drawn from the veins, arteries, and capillaries. And I will tell you, capillary composition, because it's a mix, of course, is going to have a little bit different composition than if it was drawn from, the specimen was drawn from the artery or the vein, but it does a little bit more closely resemble the composition of blood from an artery. So again, please review those composition differences in your text. You may have heard of arterial blood gases, ABGs. Those are not drawn by phlebotomists. Those are drawn by specific, and that's from the artery, from specifically trained RNs or respiratory therapists. All right, so let's talk a little bit about the components of blood. I was going to see how much. So we're going to talk about a couple more things: the components of blood, hemostasis, and coagulation, and then that's going to conclude our review today. Our blood carries vitamins, electrolytes, hormones, antibodies, heat, and oxygen, of course, as we've already talked about a lot, to all the tissues and cells of our body, okay? It also transports, as we've said, carbon dioxide and waste products to our various organs, including our lungs, which we've already talked about, but also like our kidneys, for example, to excrete the waste products, and then, of course, the lungs to excrete the carbon dioxide and get more oxygen. So blood is about 45% cellular components. So that means like red blood cells, white blood cells, and platelets. So about 45% of our blood is made up of those. The other 55% of our blood is plasma. Now, plasma itself has several different components to it. So 55% of our blood is plasma, which includes water, proteins, glucose, electrolytes, fibrinogen, and some other substances. So let's review a couple of key terms here. A hormone is a chemical that is produced by cells that affect the function of other cells and just how our body functions, right? An antibody is a type of protein the immune system produces as a threat of some kind. Okay, we get invaded by a germ, the antibody comes, it gets rid of it. Fibrinogen is a plasma protein that converts fibrin to form a clot when we're bleeding, okay? And we're going to talk a little bit more about fibrin when we get to hemostasis and coagulation. Bone marrow is the soft tissue that's inside of all of our bones that produce our blood-forming cells. So if you didn't know that, our blood cells are produced inside of our bone in the bone marrow. An antigen is a substance that's capable of inducing an immune response, and a specific immune response. An antigen is what triggers the production of an antibody, okay? So we get exposed to a germ, the antigen triggers the antibody response, and if we've been exposed to before, it's like, oh, I got this. I know how to fight this germ. Red blood cells, you also need to know that they are called erythrocytes. So again, red blood cells and erythrocytes, the same thing. They circulate in our body for about 120 days, at which time they disintegrate, and the bone marrow replaces them with brand new, fresh red blood cells. Our red blood cells are important because they carry hemoglobin and oxygen. Hemoglobin is what gives the blood its red color. Heme, it gives it that red. White blood cells are also called leukocytes. Like we talked about earlier, they help protect the body from infection by destroying pathogens and helping to create those antibodies. Platelets are also called thrombocytes. They are important in the aiding of clot formation, and they do that by sticking to the lining of blood vessels where there's an injury to help form the clot. So, hemostasis. There's a lot of words that begin with H. I'm not going to go with hemostasis, homeostasis, etc. Make sure you get those clear in your head. Hemostasis is the clotting process. Stasis means like the slowing down or stopping. Heme, blood. So hemostasis. Coagulation is the clotting, right? So coagulation, what you need to remember here is that it has 5 distinct phases that occur very rapidly, and you need to know these phases. So the 5 phases of coagulation are 1 is the vascular phase, 2 is the platelet phase, 3 is the coagulation phase, also known as the coagulation cascade, 4 is clot retraction, and 5 is fibrinolysis, okay? Or fibrinolysis. Depends on how you want to say it, I guess. I think I say it different every time. All right, so let's talk about each one of those phases because you do need to have a basic understanding of each of the 5 phases of the coagulation process. So number 1, the vascular phase. This is when a vessel is injured, the vascular phase is the narrowing of that vessel really rapidly. Why do we do that? Well, if I have a vessel that's been injured and I narrow it, make it as tiny as possible, what's going to be less? There's less blood flow, okay? Less blood flow can go through. Number 2 is the platelet phase, This is when our blood cells, our platelets, clump together and attach themselves to that injured vessel, basically creating a plug for the leak, right? The coagulation phase, or the coagulation cascade, is a very complicated process that involves substances such as fibrinogen, calcium, and clotting factors that all work together to form a clot. You do not have to know the in-depth details of the coagulation cascade. You just need to know the basics. So basically, a blood clot is a fibrin meshwork that seals off the injured portion of the vessel, okay? Clot retraction, stage 4, or phase 4, I should say, is when the blood clot shrinks. Okay, so I have an injury, I've formed a little clot, and then that clot is going to shrink, and as it's shrinking, it's pulling the edges together to help it heal, okay? Maybe this is a better way. So I have a big open cut, I form the clot's forming, and as that clot's forming, it's pulling those edges together. Finally, fibrinolysis, or fibrinolysis, is the process of breaking up and dissolving the clot as other cells come to finish the repair. So you don't need a clot forever, right? The clot does its job. It stops the bleeding, it pulls the edges together, but you don't want that clot to stay there forever. So fibrinolysis is the breaking up, lysis or fibrinolysis, because lysis, anytime you've seen that, it's the breaking apart. It breaks up that clot, lets the other proteins and such do its job to repair that injury. Now, sometimes we have bigger injuries to our vessels, right? So sometimes they require surgical repair if they're big enough or large enough. And this is why, so as a phlebotomist, how does some of this, the coagulation phases relate to us as phlebotomists? Well, when we apply direct pressure after we've just done a venipuncture, we've taken the needle out and then we apply direct pressure to that venipuncture site, we're helping that process happen. We're restricting that vessel and restricting blood flow to that vessel. So that's that kind of vascular phase, and that's going to facilitate in the clot formation. So it's why it's so important that we assure that we apply pressure to the venipuncture site after we're done. And if people who have prolonged bleeding or on medications that cause prolonged bleeding, we want to make sure to hold pressure for even longer to make sure that we're stopping that bleeding and aiding in that coagulation process. All right, you guys, I know that's a lot. This is a heavy, heavy week. I promise practice is going to, with the electrical system, with the circulation system of the heart, is going to help you to feel more comfortable with these. Of course, you can use other resources to help review and study if you need to hear it in a different way, help each other out. But just practice with these and let me know if you have any questions whatsoever, and I'll be happy to help. So